हेलो एवरीवन, आज न्यू वीडियो शुरू करते हैं। इसका नाम है एंडोक्राइनोलॉजी पेपर 1। एंडोक्राइनोलॉजी का पेपर 1 है। इसका फर्स्ट क्वेश्चन है, हाइपर एल्डोस्टेरोनिज्म कॉजेज ए हाइपरक्लेमिया, बी हाइपोनेट्रेमिया, सी बैक वाटर रीअब्जॉर्प्शन एंड डी hypoclemia. The right option is D, hypoclemia. Next question is, a 30-year of female presents with history of amenorrhea and bitemporal heminopia. The diagnosis is A, craniopharyngioma, B, pituitary adenoma, C, pheochromocytoma, D, hypothalamic glioma. The right option is pituitary adenoma. Next question is, central diabetes insipidus is characterized by A, low plasma and low urine osmolality, B, high plasma and high urine osmolality, and C, low plasma and high urine osmolality, and D, low urine and high plasma osmolality. The right option is D, low urine and high plasma osmolality. Next question is, cutting of pituitary stalk decreases all of the following hormone except A, ACTH, B, GH, C, prolactin, and D, FSH. The right option is prolactin. Next question is, in 16-year-old female water deprivation test was performed and after 3% loss of body weight, plasma osmolality was 350 mmol per kg and urine osmolality was 550 mmol per kg, and after administering vasopressin the urine osmolality was raised to 700 mmol per kg. The diagnosis is A, central DI, B, nephrotic DI, C, psychogenetic DI, and D, SIADH. The right option is central DI. Next question is, storage from the thyroid hormone is A, triiodothyrosin, B, triiodothyronin, C, thyroglobulin, and D, diiodothyroxine. The right option is C, thyroglobulin. Next question is, diagnostic test for pheochromocytoma is A, USG, B, estimation of urine metapherins, C, estimation of urine 5-HIAA, and D, phenylalanine test. The right option is estimation of urine metanephrines. Next question is, in addition disease the following is seen: A, hypernatremia, B, hypoclemia, C, hypertension, and D, hypotension. Right option is D, hypotension. Addition disease is hypotension. Next question is, 95% of diabetes mellitus is associated with A, HLA-B27, B, HLA-B3 and B4, C, HLA-DR3, DR4, and D, HLA-A3. Right option is HLA-D3 and D4. Next question is, all are causes of polydipsia except A, primary polydipsia, C, B, SIADH, C, diabetes insipidus, and D, aldosterone deficiency. The right option is C, diabetes insipidus. Next question is, inappropriate ADH secretion is seen in all except A, head injury, B, odd cell CA of lung, C, acute encephalitis, D, chromophobe adenoma. The right option is B, chromophobe adenoma. Next question is, thyrotoxicosis can be differentiated from anxiety neurosis clinically by A, tachycardia, B, sleeping pulse rate, C, moist hand, and D, ankles jerk. Right option is C, moist hand. Next question is, slotted HB percent which indicates good control of diabetes: A, 8%, B, 10%, C, 15%, and D, 20%. Right option is A, 8%. Next question is, dawn phenomena refers to A, early morning hyperglycemia, B, early morning hypoglycemia, C, hypoglycemia followed by hyperglycemia, and D, high insulin level. The right option is A, early morning hyperglycemia. Next question is, heel pad thickness is useful in A, hypothyroidism, B, acromegaly, C, PEM, and D, hypogonadism. The right option is B, acromegaly. Heel pad thickness is useful in acromegaly. Next question is, enzyme deficient in DM is A, glucokinase, C, glycokinase, and C, hexokinase, and D, phosphorylase. The right option is A, glucokinase. Next question is, karyotype of testicular feminization is A, 45XO, B, 47XXY, C, 46XY, and D, 46XXY. Right option is C, 46XY. Next question is, malabsorption of amino acid is seen in A, alkaptonuria, B, cystinuria, C, homocystinuria, and D, phenylketonuria. The right option is B, cystinuria. Next question is, testosterone is secreted by A, Leydig cell, B, serotioid cell, C, germ cell, D, adrenal medulla. Right option is A, Leydig cells. Next question is, androgen independent hair growth is seen in with all except A, eyelashes, B, eyebrows, C, lanugo hair, and D, pubic hair in female. Right option is D, pubic hair in females. Next question is, necrobiosis lipodeca is seen in A, DI, B, Lyme disease, C, DM, and D, Simonet's disease. Right option is C, DM. Next question is, hourglass vertebrae and triradiate pelvic are seen radiologically in A, thyrotoxicosis, B, myxedema, C, cretinism, and D, hyperparathyroidism. Right option is D, hyperparathyroidism. Next question is, premature old aged appearance is one of the feature of A, Ehlers-Danlos syndrome, B, Marfan syndrome, C, pseudo-ophthalmoma elasticum, and D, cutis laxa. Right option is D, cutis laxa. Next question is, serum iron is raised in A, thalassemia major, B, RA, C, polycythemia, and D, all. Right option is A, thalassemia major. Next question is, vitamin D resistant rickets inherited as A, autosomal dominant, B, autosomal recessive, C, X-linked recessive, and D, X-linked dominant. Right option is D, X-linked dominant. Next question is, Fisher ring is seen in A, hemochromatosis, B, PR biliary cirrhosis, C, hepatolenticular degeneration, and D, senility. Right option is C, hepatolenticular degeneration. Next question is, disease associated with increased age of father, A, Down syndrome, B, Marfan syndrome, C, phenylketonuria, and D, albinism. Right option is B, Marfan syndrome. Next question is, Gaucher's disease is in adult is associated with all of the following except A, massive splenomegaly, B, bone erosions, C, pancytopenia, and D, CNS involvement. Right option is D, CNS involvement. Next question is, characteristic of Wilson's disease include A, KF ring, B, ceruloplasmin deficiency, C, psychiatric symptom preceding neurological symptom, and D, all. Right option is D, all. How many parts are there in insulin receptor? A, 1, B, 2, C, 3, and 4, D, 4. Right option is D, 4. Next question is, prostaglandin found in seminal fluid are secreting product of A, prostate, B, seminal vesicle, C, Leydig cell, and D, Sertoli cell. Right option is B, seminal vesicle. Next question is, TRH stimulates TSH and A, growth hormone, B, oxytocin, C, prolactin, and D, gonadotropin. Right option is C. Prolactin. Next question is Somyogi phenomenon is A. Hyperglycemia followed by hyperglycemia, B. Hyperglycemia followed by hypoglycemia, C. Glycosuria with normal blood sugar, and D. Reactive hyperglycemia. Right option is A. Hyperglycemia followed by hypoglycemia followed by hyperglycemia. Okay. Next question is true about creatinine is A. It is a muscle protein, B. High energy compound, C. Measures GFR, and D. All. Right option is A. It's a muscle protein. Right. And next question is neurotransmitter which controls secretion of prolactin. A. Serotonin, B. GABA, C. Somatostatin, B. Dopamine. Right option is D. Dopamine. Next question is in the adrenal gland androgens are produced by the cell is in the A. Zona glomerulosa, B. Zona radicularis, C. Zona fasciculata, and D. medulla. Right option is B. Zona reticularia. Next question is site of ADH action is A. Proximal tubules, B. Loop of Henle, C. Vasa recta, and D. Collecting tubule. Right option is D. Collecting tubule. Next question is increase in insulin receptor is seen in A. Starvation, B. Obesity, C. Acromegaly, and D. Diabetes. Right option is A. Starvation. Next question is FSH is secreted by A. Chromophobes, B. basophils, C. acidophils, and D. theca interna cell. Right option is B. basophil. Next question is spermatozoa mature in which of the following organ? A. Epididymis, B. Vas deferens, C. testis, and D. prostate. Right option is A. Epididymis. Next question is precursor of testosterone is A. Methylated testosterone, B. pregnenolone, and D. aldosterone, and D. cortisol. Right option is B. pregnenolone. Next question is blood testis barrier is formed by A. Serotolin cell, B. Leydig cell, C. Epididymis, and D. Vas deferens. Right option is A. Serotolin cell. Next question is not a glycoprotein. A. FSH, B. LH, C. TSH, and D. GH. Right option is D. GH. Next question is Lawrence-Moon Bardet-Biedl syndrome is characterized by all except A. Primary amenorrhea, B. Anorexia nervosa, C. polydactyly, and D. retinitis pigmentosa. Right option is B. Anorexia nervosa. Next question is postpartum pituitary necrosis lead to Kallmann syndrome, B. Sheehan syndrome, C. Addison syndrome, and D. Froelich syndrome. Right option is B. Sheehan syndrome. Next question is Conn's disease result in A. metabolic alkalosis, B. metabolic acidosis, C. respiratory alkalosis, and D. respiratory. Right option is metabolic alkalosis. Next question is commonest symptom of pheochromocytoma. A. headache, B. hypertension, C. hypoglycemia, and D. papilledema. Right option is B. hypertension. Next question is hypothyroidism result in hyperreflexia. A. hyperreflexia, B. delayed relaxation of tendon reflexes, C. hyperreflexia with third sustained clonus, and D. areflexia. Right option is D. Right option is a B. delayed relaxation of tendon reflexes. Next question is all are symptom of Graves' disease except A. carotinemia, B. ophthalmoplegia, C. goiter, and D. pretibial myxoedema. Right option is A. carotinemia. Next question is hypothyroidism present with A. oligomenorrhea, B. polymenorrhea, C. menorrhagia, and D. metrorrhagia. Right option is A. oligomenorrhea. Thank you. Please more share and subscribe channel.